Hello, everyone. This is Dr. Marzban from CIC. We're going to be talking about the post-traumatic cervical spine injuries. We're going to review some important information, what kind of treatments would be suggesting to the patient, and do's and don'ts. Definitely, we look closely to the don'ts that would be causing further injury to the patient or would not be beneficial to the patient. And so let's just start. This is a cervical spine series, of 3 views, and you see that we have AP view on the left-hand side. We have open mouth, upper cervical view. Again, is AP, but the mouth is open to look in the back of the mouth, where it is not as obvious in the case of the AP view of the whole cervical spine X-ray. And here's the lateral view. And so we look at the alignments in all X-rays. And for example, we'll look at the bottom of the mastoid process on both sides to see that if in horizontal line, and if there's any issue with the balance and the symmetry of the structure. For example, here it shows that we have vertical normal scenario right here, and then it tells to the side. So that would be very important to us, even though it is a very small amount of deviation, and even the report might say that it is normal for us as a chiropractor. It would be very important to note even a slight misalignment that we can detect. We look at the structure behind the mouth in open mouth X-ray, and we look at again for different displacements, misalignments. For example, we look at the dense and the lateral mass of the atlas, how far they are. We look at the side and to the side compared to the side, and also we look at the atlas and axis facet joints, and again we compare the right and left side. Here is the lateral view. We have the line right here, which is associated with the curvature of the cervical spine, and there are different ways of looking at that curvature, and then if you look at the cervical spine lateral view, there are several things that are important to us to study. Here's a C1, here's a C2, here's a C3, it goes down and to C7. Here would be the disc, which most of us are familiar with, and we heard about these vertebral discs, and they're nicely done, they're thick, and the curvature of the neck look very normal as well. We look at the density of the bone to see that if there's anything abnormally being seen, and we look at the distances between the vertebrae spine, and we also look at this joint that not many patients are familiar with that name, facet joints, and so in that case, between the C3 and C4, actually there are 3 joints associated with that. One is the disc and 2 of the facet joints. And the facet is very important, which we're going to look at it in the following slide. And we'll look at the distances between the spine and also the curvature, as we mentioned. And you notice that the distance between the C1 and C2, between the normal, which is on the left side, and abnormal, which is on the right side, are different. and you see the bigger gap between C1 and C2 spines. But at the same time, even your eyes as a patient, you can detect that the curvature, which is normal here, is not matching with the abnormal case right here, and you notice that the neck is kind of bent forward, which opens up the distance between the spines and narrowing down the distance between the anterior part or the front part of the vertebrae. And this misalignment would not be very good structure to have a disc to stay healthy. And again, the X-ray does not show the discs, and even though it's being highlighted here, and this is just the estimate disc space, and but the disc could be protruded at any side right here, which X-ray is not detecting that, because this X-ray does not show the discs, but it shows the bones. But we are assuming the disc right here would have a shape as such. And here's the facet that I was talking about. And you notice that the facets between the left side, which is normal, and the right side, which is abnormal, they don't match 100%. And any of the misalignment with the cervical, it would be putting pressure on the cervical facet joints, which itself is it could be very painful, and not only at the neck area, but also could have refer pain to the head to cause a headache, or is going to be having refer pain to the upper shoulder and shoulder blade, which again could be because of the refer pain from the facets or even the from the discs. So the here's the disk space. Again, the disk space are is normal here, and but again, um, the as you go down, you notice that at this point right here, the because of the loss of the normal curvature of the cervical spine, you have more proximity in the back of the vertebrae bodies, and that definitely would be an indication to go further study with the MRI. Because any misalignment, as I mentioned before, could cause a displacement of the disc either posteriorly or anteriorly. Here is the other measurements that we are interested in. We talk about the distance between the atlas and axis, in this case the spine, and you see that the head is forward placed or flexed, and we also measure the distance between the part of the axis, which is called the dens, to the posterior mass and anterior mass of the atlas. Here is the MRI showing that what we have, not only showing the vertebrae, we have a two-dimension picture of the cervical spine, and here it shows that we have a cerebellum, brainstem, spine, and it travels through the vertebral foramen. And here's the back of the neck, and a lot of muscles around here, which you can see and which cannot be seen on X-ray. And here is the mouth, and here is the trachea, and you notice that we have the discs and the curvature, which they don't look very normal and healthy. And one of the things that we can see on MRI are the discs, and here is the disc that has the good amount of water in the disc, and as you should know, is that the amount of water which is whole in the disc is at a high amount, and this shows that at the brighter color, but you notice that right here, the brighter color of the disc are disappearing, and that means that they are dehydrated, or as well as there's a damage to the discs. But as you notice that the cervical spine is not normal, and there's a straight, there is a forward bending at this point, and at the same time you will see that we have disc protrusion at different segments, not only anteriorly but also posteriorly detected in the case. And here's a spine, and by having the disc protrusion, you have a lesser space for the spine to run, and that could put the pressure on the anterior side of the spine, which is dealing with the different part of the functionality of the brain, which is going to be motor system. And the understanding the mechanism of the spine, how it works, and what part of the spine can be damaged due to the disc protrusion, it is very important. And also, it is very important to notice that having the cervical spine losing its curvature, it put the pressure on the spine to be pulled up, which causes the traction to the spine, and the spine does not lack that type of stress, and therefore it could cause a degeneration. So, returning this cervical spine back to normal and having the disc to get better as much as it is possible, and that's very essential. And it's also essential to mention that it is very important for people they have injury to the neck. They seek for treatments very early time, because at the acute case, the recovery is much faster, and at the chronic case, the recovery becomes more difficult. This picture shows that we have rear-ended type of injuries, and when someone hits you from the back, the driver in the front will have neck uh, trauma, and due to the very aggressive motion that is being imposed on the neck. So here is the driver that is driving, and then the car is hit from the back, and then the seat will push the chest forward and causes the lower cervical upper thoracic injury. At the same time, the neck goes bent down from the forward, and then it goes backward. And but at the same time, you have a lot of muscles that all of a sudden become stretched, and that would cause the soft tissue damage. And we're going to look at the ligaments and other structures that are associated with the neck. They all can be affected one way or another. Later time, after the fraction of a second, the second part of the neck movement would be hyperextension. The neck is being bent backward, the head goes backward, and that caused the damage, again, not only to the back of the neck spine due to the jamming of the space, but also hyperstretching of the soft tissue, as well as the disc that is between the vertebrae. They get stressed, and causes the further damage. So it has the double dip effect, and so some damage would be affected by the initial part of the injury, and then right after that, the further damage can be happening to the neck due to the whiplash. This slide shows that very much the same thing, but it shows the third part of the injury, This is, as we talk about, the seat is going to push forward, the head goes backward. Then the second part is the hyperextension, and then it can have the hyperflexion. And those all scenarios would be damaging the uh, discs as well as the facets between the vertebrae, and also causes some tearing of the other soft tissues, such as the ligaments that we have between the spinous process. And so the damage, uh, which usually people they think is going to be happening only to the disc, that is not necessarily the case. The damage can go farther to the facets and other soft tissues around the vertebrae. This picture again shows the hyperflexion and hyperextension scenario that could be affecting the soft tissue and the joints between the vertebrae. As I mentioned before, there are a whole other bunch of soft tissue which are associated with the neck, and neck is very busy area, huge traffic by the nerves, blood vessels, muscles, ligaments, and all this area right here in the back of the neck, which we usually don't, think about it. They all can be one way or another be affected by the neck trauma, like auto accident, sport accident, falling, as I mentioned before. And so the nerves that going in and out for motor as well as the sensory, they all can be affected due to the neck injury. And you notice that the nerves that coming from the neck, they travel up to the head, and also they can travel down to the upper neck and upper back. And the muscle, nerve, blood vessels, and all different cascade of the soft tissue which are seen on this picture can be injured. And again, not necessarily every neck injury, auto accident, sport accident, falling, and trauma to the neck can cause the damage to all of those. But it is very important to know our stuff, what we are looking for, and how we can diagnose the patient, and what would be the best treatment that we can offer to the patient. If it is not in our office, we definitely need to refer out to the specialists, which are more trained in the area that they can treat the patient fully. This slide shows that we have muscles all around the neck, upper back, shoulders, and the chest, the back, and all of those muscles can be damaged due to trauma, and the hyper stretching of this muscle all of a sudden definitely will not be very pleasant to the muscles, and not the beginning. Patient might feel the soreness, but pain and trigger points and the damage to the joints at the same time would be limiting the range of motion and the strength of the muscles associated in the area that injury is happening. Not only that, patients usually have headaches, and also vertigo is very common in the neck injury, head injury. And here are the muscles which are called the suboccipital muscles. They are very important muscles to keep us balanced. And if any of those muscles are damaged to the due to the accident, it would give the brain wrong signals, and the wrong signals to the brain, which is called the proprioception. It gives the brain not to be able to do its job. And one of the important jobs that the brain has is to keep us balanced and not to fall. But at the same time, we have vertebrae, they're going up through the transverse foramina, and these vertebrae are very important to study closely when the patient comes to your office. The first few visits, definitely you would like to examine these vertebrae are fully intact, because any damage to the vertebrae, twisting, pulling, and compression can damage this blood flow in this vertebra, and you will like to examine the patient vital signs. At the same time, the appearance of the patient in your office give us clues what could be the extent of the damage. Initially, we go with the passive therapy to reduce the soft tissue inflammation, reduce the pain. Inflammation gets better, pain also gets better. And at the same time, as I mentioned before, due to the soft tissue damage, the patient is going to lose the range of motion. You would like to work on that with the removing the inflammation and reducing the pain. Definitely, the patient has an easier time to move the joints. And after the passive therapy is completed or completing, then the active therapy comes in and to replace the passive therapy. And this is more, I don't want to say aggressive, more hands on by the doctor and the therapist to further reduce the pain and increase the range of motion by helping the patient to go farther than what was the limitation in passive therapy. At the same time, when the muscles and soft tissues are recovering and recovered, then you will like to go to the pretty much the last step of the therapy, which is the muscle strengthening. And so the muscle strengthening would be at the later time of the therapy, usually. What to consider is that taking full history, patient had prior damage, trauma, injuries, and so you would like to see that the accident, which is fresh accident, recent accident, what additional symptoms and the issues brought to the patient, and fully and thoroughly examination is very essential in the areas that the patient has a complaint, especially. And we would like to treat the cause uh, to remove the symptoms, and not the only treating and helping the patient with the symptoms, because as long as the cause is not being addressed by the physician and therapist, the symptoms will come back, even though it went away, temporarily. We don't offer adjustments and manipulations in the acute cases, and most of the time, and this is a no-no, because we would like to make sure that the patient is having the best response to the treatments, and adjustment manipulation could cause further damage to the neck if the cases are acute. In the chronic case, I'm not saying that the adjustment and manipulations would be something that we offer, but we offer adjustment and manipulation at a later time. So during the adjustment manipulation, it is very important to uh, get it done at the time that the patient can benefit from it, not causing further damage. In order to do that, as we talked about before, we refer the patient to get the X-rays or MRIs on the areas that the patient need. And if there is something that is a red flag or something that we cannot do or offer any therapy for the patient, definitely we'll send the patients for appropriate specialists to look into and evaluate the patient further, and so the patient can get the best treatment as well. There are different issues that we try to avoid um, uh, treating the patients in our office, such as dislocation of the joints, fractures, and major nerve injuries that is not being treated by simple uh, physical therapy. And again, sometimes it is the inflammation of the soft tissue around the vertebrae or muscles and other soft tissue in the neck could cause the compression and damage to the nerve. And in those cases that we can offer the treatment, we do. Otherwise, we refer them out. The head injuries that cause, especially brain injury, or causes the other organs like the vestibular system, or even as simple as the TMJ, that which is temporomandibular joint injuries, that definitely would be something that we would like to refer them out, done by specialists. Internal organ damage, again, it is very important to note when the patient comes with especially with a severe car accident that could have the physical impact due to the airbag deployment or the physical damage that they have due to contusion to the steering wheel. Even the headrest can have the bad effect, grave effect on the neck and the head, and also heading to this the side door, and anything else needs to be very closely looked at and in the examination. And again, the knees and the hip are also we have seen being injured during the accidents, like car accident, auto accidents, because of the impact of the knee to the dashboard, and that, or even the airbag caused the damage to the knee and the hip area. Again, I hope that you enjoy the presentation. Well, I just want to be giving the idea that auto accident can be as simple as very small trauma, and it can go further to become very devastating to the patients. And it is very important for the chiropractor, physician, therapist to evaluate the patient correctly and give the best treatment possibly available to the patient, even in the office or somewhere else that patient can benefit from. You have a wonderful day. Thank you for listening.